Talk Erie and the Joel Natale Show, live from our Kingdom Financial Group studio here at 5th and State, also live on Facebook and YouTube. And we're having the crucial conversations that Erie needs in May, which I know was 10 days ago, but still, May is Mental Health Awareness Month. And we wanted to take a moment here to bring in our friends from LECOM Health, from both the Achievement Center, LECOM Health, as well as LECOM Behavioral Health. And I want to introduce to you here in studio, to my left is Cassie Dundon. She is the Executive Director of the Achievement Center of LECOM Health, Corey Counseling of LECOM Health, and an administrator at LECOM Institute for Behavioral Health, which was formerly known as, ambulatory services at Mill Creek Community. Cassie, how are you? Pull that microphone nice and close to you there. There you go.
I am well and so glad to be here. Thank you for having us.
Appreciate it very much. Carrie Todd is with us. She is a mental health systems specialist at the Achievement Center of LECOM Health. How are you? And pull that microphone toward you. There you go.
Very good. Thank you.
Okay.
Glad to be here.
And we've got Meghan Kinter. She is the Chief Strategic Growth Officer for LECOM Behavioral Health and Project Manager for the LECOM Health Bridges for Older Adults. Meghan, good to see you. Appreciate it.
It's good to see you.
All righty. I think folks have been in here before, but kind of remind us of your origin stories and so on. Start with you, Cassie. Grew up around here, or yeah?
I'm from Du Bois.
You're from Du Bois.
Yeah, 2.5 hours down the interstate.
And you went to school for?
I did. I came here to go to Gannon grad school for my master's in counseling. I met my husband, Chris, who is born and raised Erie, would never leave. Someone would have to drag him out.
Yes.
So we were going to plant some roots and make the best of it. And I've been here ever since. So
fantastic.
Love it.
Meghan, you got the mic. How'd you come up?
I Erie born and raised.
Yeah.
Lived a little bit out of state for a little while, but have been around. So Harbor Creek grad, go Huskies.
Yes.
And then got my master's at Mercyhurst, go Lakers. And then spread the love down here at Gannon with my PhD. So
Fantastic. Okay, so tell us what those degrees are, because I think it's important if people want to pursue this line of work or this profession. How do you get into it? Yeah,
I'm absolutely the odd duck out here.
Okay.
I do not have experience in behavioral health. I acquired that through work with nonprofits and specifically in behavioral health. My degrees are in organizational learning and leadership, both my master's and PhD. My undergrad is actually in public relations.
Nice. So
not about broadcasting.
It shows where you can go with a communications type degree.
Sure, absolutely.
Yeah, absolutely. That's cool. How about you, Carrie? How'd you come up and so on?
I'm actually a new Erie, Pennsylvania resident since December. We arrived after the snowstorm.
Oh my gosh, really?
Yeah.
That soon?
That soon. Moved here from Wyoming is kind of an unexpected twist. The long and short of it is I got hooked into the Achievement Center. Was excited about the work that they're doing that now I get to be a part of there.
Okay, where in Wyoming? Were you near Cheyenne or?
No, we're in Rock Springs, which is southwest.
Okay.
So other side of the state.
Nowhere near the train station in Yellowstone.
No.
Okay, thank goodness.
Yeah,
right.
yeah, no, far away.
Yeah, and again, only people that watch Yellowstone know anything about that. Kind of Denver adjacent, that kind of thing, right?
Yeah,
that kind of vibe.
Lake.
Yeah.
Mm-hmm. But yeah, small town.
How do you find Erie?
A Google search. Yeah. If you didn't know, Erie is ranked one of the most family-friendly cities in Pennsylvania, as up and coming. So.
I love it.
Yeah.
Well, fantastic. Welcome.
Thank you.
Glad that you found us. That's amazing. And if there's a theme for this, where we are in behavioral health and mental health, I'd like all three of you to kind of weigh in. Where are we at? Because I think there's more attention to it.
Sure.
But I'm not sure all of the narrative is right on. Talk about it, Carrie. Okay. Yeah. Cassie, excuse me. Yeah.
We're going to do that the whole time.
Yeah.
Cassie
Carrie,
right next to you.
Yeah.
I can kick us off. I'm sure we all would have some different perspectives. I think in the past there's been a narrative about a lot of stigma that would prevent people to reach out for help, and we're starting to see a bit of a decline in stigma. So more folks are willing and able to reach out and say, hey, I think I have something going on, or I know someone in my family that does. And so that's exciting, a little less stress there in help seeking. And so that means the other side of that is there's more need now than ever, more people reaching out for help, and the acuity or the intensity of the need that we're seeing is increasing. So when people...
So more diagnosis leads to more need?
More people reaching out for help is leading to more people needing services.
Sure.
And then part of our challenge is just keeping up with that. We need a workforce that supports that many people with need. And so we're just right smack in the middle of a workforce shortage. So we're doing really important, meaningful work, but you got to have the right mindset and the grit to do that work, right? It's in a nonprofit setting. The unpredictability of you never know what you're going to get into every day can be both exciting and tiring. So we need more people to help us meet all the need that's making its way through our doors.
Weigh in on that, Carrie.
As far as the need, or kind of where we're at with mental health?
Well, yeah, both. Yeah, really. I mean, because again, you're adding this to the solution by being here, helping Erie folks.
Yeah.
Find what they need.
So I think in line with what Cassie's saying, we're seeing that decrease in stigma where more people are reaching out for help, accessing supports, but navigating those supports is still really challenging. So you add in, there's all these different systems that interplay with one another where you need to have maybe your insurance line up with the physician that says you need a level of care. And so we might be able to now bridge that gap of I can get out and talk about it, but now what? Now what do I do? And so looking at how we start making change within those systems and kind of the communication that's happening amongst the different agencies that are supporting kids and families and all of the behavioral health needs to make that care more accessible too.
Yeah. Meghan, yeah.
Sure. I think that some of the things that we're excited about in the field is the innovation and the progress that we're making on new treatments, new services. I think that the other piece of that conversation is teaching people, so now that the stigma is starting to reduce, teaching people how to interact with, how to have the conversation. So I might recognize some symptoms. What do I do next? And so that's not only the system navigation, but getting them connected to the right services. So I think it's bringing up a lot more, I guess, different types of conversations than we've been used to having in the past.
How much of a, I won't call it a threat, but how much of an issue is it of this self-diagnosis? I mean, people are watching a TikTok saying, I've got this, DSM, condition,
Sure.
and people are saying, well, that looks exactly like me. And all of a sudden, now you have is that an overblown thing?
Oh, I could see it going both ways. I mean, I think in the clinical sense of things, we trust that people are the expert on themselves. And
That's a good thought.
We're walking alongside them and whatever their journey looks like. And so they're onto something if they think that something's off or they're uncomfortable or they're thinking that something might be going on and they want to talk to someone about it. So we certainly don't want to minimize that experience. There's something to it that's bringing them through the door, whether it's lining up with a diagnosis they might be seeing someone talk about on TikTok or not. It's activating them to look into it more, and we would never want to discourage anybody from doing that.
Okay. I just want to capture the moment that we're in right now because mental health has never been talked about more than 2025, I don't think, anyway. But again, that's a good thing, but it also, like you say, has not a dark side, but it has challenges with it, right?
It definitely does. And the more people talk about it and normalize it, the easier it makes to keep the conversations going. But I'm sure we've all done it with the physical health side. You can type in a couple of your things and you're going to all of a sudden have every
stage 4 cancer, you know what I mean?
Yeah, and you need to get in there now.
Right.
But I the part of that is helpful for the work that we're doing is just it is activating people to do something about it. And they don't have to worry or wonder, I can talk to somebody about this. I don't feel maybe as much shame as I might have felt of before to just ask about it.
I go ahead.
And I also think it's helping educate the population at large. So even if I ask the question and I'm off base, it allows me to have education and confidence that I am okay, I'm on the right path, or here's the right supports that I can get. And the more people are educated, I think the healthier our whole community will become.
What does the conversation being common in social media, in regular spheres, do you think that, again, it eliminates stigma, and that's a really good thing, but does it? I've just been reading these articles about, are we lowering the amount of resiliency in our people? Are we allowing for young people to not have grit like they should? Are you reading any of this stuff too? Go ahead. She wants to weigh in, Carrie. Yeah, go.
So,
and I didn't know I was going to go this hard so quickly, but
I'm in there. So I have a lot of experience serving teenagers, and so the TikTok and the social media, there's a lot of information out there, and like you're saying, it's great that they get to talking and they get to wondering and they're able to ask questions. The part where I think it can kind of get a little concerning is where we start not just recognizing traits within ourselves within other people, but we are saying they have that and that means I have that too.
So you have the pop psychologist,
right,
who has no room to be making that diagnosis.
Or we have like influencers who are saying,
yes,
hey, I have this condition and this is what it looks like for me, which is great. Get that out there, and for people to know that different various disorders can look different in different people, right? Symptoms present differently. And so just because that resonates with you doesn't mean that's your diagnosis, but it might be, hey, I've got enough of those things going on that I should ask someone else about this, or I can get curious about this. But then the step further of getting your treatment and therapy is different than, let's say, coaching, or, self-help is different. That's where it kind of, I think, veers off for me, of how are we getting the need met.
All right, I'm going to take my first break here with our friends from LECOM Health. They're in the behavioral space and Achievement Center. Again, doing great work on the west side there and all around town. We will get to some of the key programs here for all ages across the spectrum. And you are tuned to Talk Erie and the Joel Natale Show. Talk Erie and the Joel Natale Show. Might be talking vertigo, might be talking anxiety. Who knows? It's all about behavioral health, and we're talking to our friends from LECOM Behavioral Health here, serving about 20,000 people each year within the Erie region, a 100-mile radius into Ohio and New York. And I want to kind of talk through some of the programs. And if you don't mind, I'm going to actually start on the older end of the spectrum. And Meghan, you're dealing with LECOM Health Bridges for Older Adults. Yes. And so tell us what that's all about.
Yeah, so it is a national program that we launched about 6 months ago. We were the only one in the nation selected by the Administration of Community Living. I think I got that right, or ACL. And what they've tasked us with doing, they found that older adults, I'm going to deviate from behavioral health very quickly, with chronic disease. So older adults with chronic disease, and that's about 85% of our population, also have behavioral health concerns. In fact, so 85% of the population has a chronic disease, 66% of that population, so 2/3, have a behavioral health condition as well. And what they were finding is that we have some really great programs across the nation that help manage chronic disease, evidence-based programs that work. So diabetes management, for example. We have these programs and these individuals that are leading these programs for diabetes management that do not know anything about behavioral health. They know a lot about diabetes management, nothing about behavioral health. What our task is, what our goal is to be able to empower these individuals leading these diabetes management classes, and I'm just picking that as an example. It's really any chronic disease management class, to be able to learn about behavioral health so that they can engage the older adults better in their programs. What we found is that they're not attending the programs, the older adults. They're either self-selecting themselves out. So you can imagine with depression and anxiety, they might not feel comfortable in that setting, isolation. Or if they're in the program, sometimes they have behaviors and symptomologies that are not typical. And if I'm a facilitator and I have no behavioral health background, I don't know how to help them. And so what our program is, what Bridges does, is it teaches them through some online free training resources how to be able to recognize that this individual might have a behavioral health condition, to be able to more appropriately respond to that individual, and then to be able to, if the, opportunity presents itself, refer them to community resources. And so we're just starting to build this. What we're really excited about, there's a 12-module online training program that will be available across the nation. So we're targeting that chronic disease management group, but it really could be for anyone. They can go online and learn these skills so that they can better engage the older adults. Our goal is actually to increase the participation of these older adults in these chronic disease management classes. But we know when they're in there, they're also going to be able to get information and resources relating to their behavioral health conditions.
Wouldn't that be, wouldn't your target be a lot of family medicine, a lot of primary care? Because when you think about it, if you have elevated, if you have hypertension or if you have diabetes, who's managing that? You're seldom even going to a specialist. You're managing that at primary care, right? And so you got to get those primary care physicians and and nurse practitioners to kind of do their checkbox on their behavioral health score sheet, right? I mean,
yeah, absolutely. And it really runs in parallel with a lot of other initiatives. Our focus for this particular program right now, because of the grant and the way that it was structured, is really just these evidence-based programs across the U.S. That are kind of classroom settings, community-based programs. Yeah. But you're absolutely right. Being able to build bridges and educate the physicians, so primary care physicians, and also the behavioral health community in their community, so the behavioral health service providers, that these chronic disease management classes are an actual gateway or connector to their services. And so it's really bringing the whole community together to be able to be more educated and to be able to provide that resource, or that, as we like to say, bridge.
You know who's really in that space too are the insurance companies. I mean, they're contracting with these folks, because the people that they can get off the diabetes meds the quickest, right?
Yeah, absolutely.
It saves them money, and so they're pushing that. And there's a lot of, I think, self-care talk in all those coaching, those online coaching deals.
Yeah,
right?
Absolutely.
So it's such an unusual. Talk about a moment, right?
Yeah.
We're in a very technology-driven moment when it comes to all kinds of healthcare.
Yes, for sure. Yeah, and I mean, and I think that opens up a lot of conversations and a lot of access for a lot of individuals who might not have had it before. And so being able to, again, expand outside of just the behavioral health service providers to be able to get this education and empowerment in other community connectors, people who are interfacing with them. This is, again, that innovation that we were talking about earlier that really helps expand behavioral health in our community.
And so did this arrive from kind of the LECOM Institute for Successful Aging, or, how did this all arrive?
Yeah, so our two service lines that are, I think, our largest. So them and then the behavioral health service line, we're
Sure.
experts
Right.
in this area. And so this opportunity presented itself. And I think that's why they chose us, is because we're bringing together side by side these two service lines. That we have the expertise in geriatric care, we have the expertise in behavioral health care. How can we really make movement in both of those areas well?
Wow. Let's talk. Let's go a little bit younger.
Yeah.
And talk about those working age folks that are either dealing with maybe a substance abuse problem, or they're dealing with mental health issues, behavioral health issues. What's available at LECOM Behavioral Health, and how is Erie sourced? Do we feel like we're in a good place for those working adult age there?
Yeah, Erie is resource rich. We're saturated with a lot of opportunity and resources, supports, and services for adults, middle-aged adults, in the inpatient and the outpatient level. So if somebody's really feeling like they're struggling and they're a danger to themselves or someone else, there's options for inpatient care. There's a step down option for maybe partial, where they're getting some support a couple hours every day, and everything in between. We also have the outpatient supports, having a psychiatric provider work with them on maybe a medication management routine, or doing some therapy in a group or an individual setting. So there's a lot of opportunity for folks to get services in that space here.
When you think about, again, a 40-something who's maybe facing, a situation or, major life change, what's some pointers that you would give them if they're, if they're just trying to cope right now? Again, I think you taught me, about trauma and so on. I mean, it could be a trauma that they're dealing with,
Sure.
At the Middle Ages.
It looks different for everybody, but if a person's feeling like they're overwhelmed, their ability to cope on their own, I would recommend reaching out to somebody. A lot of people feel comfortable starting with someone that they know that's not a professional. Certainly don't want anybody to walk alone. So a lot of social connection can do wonders for certain folks' mental health. So a trusted friend, a spiritual advisor, someone in their neighborhood. But if they feel like they need to take it a step further and they're looking for some professional support, there's a lot of options. And there's options for everybody. If you're not a person that wants to go to an in-person appointment, man, technology is really advanced. You can chat your therapy session. You can text it.
Wow.
You can do a virtual appointment. You could do it at a time of day that works for you. There's so many options to meet people where they're at, depending on what their need is.
I've got to go to break, but I want to ask you about some of these new apps.
Yeah.
Because, are we cool with the apps? I mean, probably it all depends on.
It really does.
We're talking about behavioral health with our friends from LECOM here, coming back after the news. Talkiri and the Joel Natale Show. We are having a strong conversation here with our friends from LECOM Behavioral Health and the Achievement Center of LECOM Health. Cassie Dundon, she's the executive director. Carrie, Todd, mental health systems specialist at Achievement Center. And Meghan Kinter, she's a chief strategic growth officer for LECOM Behavioral Health. That's a cool role for you, Meghan. Again, Dr. Kinter, I should say. You know, I mean,
Please not.
no, not today. All right, but no, I mean, you know, LECOM keeps positioning themselves for, you know, that major, really national impact. In fact, you know, all you got to do is watch a. What is it? Bills or Browns?
Oh, yeah.
You know,
I think
practice.
like the Bills,
Yeah, practice deal and see the LECOM jerseys there. So we talked about the older folks.
We did.
We talked about the middle-aged, working age folks. Before we go to minors, let's talk about this critical age of the Gen X, 18 to 25, 18 to 34. I feel like there's a lot. I almost feel like they're the most influenced by what's going on nationally in social media, by influencers and things. And I wanted to ask about the apps and just give some, you know, you were saying off the air, the idea of texting, you know, therapy may not be the most effective.
I mean, it does. I guess everybody's got their preference for communication style, and you got to meet people where they're at. So I'm a little more old school, trained usually just in that in-person talk therapy. I've done through the pandemic the virtual therapy.
Right. But that was face-to-face on Zoom, right?
The texting's a stretch for me. But if I'm thinking about just the way people are growing up now and what they're more used to, if that's their method that's comfortable for them and that gets them in a brave enough spot to be able to talk in a way that works for them, I could see the potential where it could still get people where they need to go. I might still be that therapist on the other side that would encourage a talk session every now and then.
Yeah.
But I wouldn't want to close my mind off to it. If it works for somebody and it gets them to where they need to be to have that conversation, I think it's worth exploring. I'm curious what Carrie thinks because she works more maybe with that age group than I do.
Do you have a lot of young adults like that?
I do. And I to your point of, yes, being able to meet them where they're at, right? So sometimes it is the text, the message is preferred communication, and it's the first way they reach out. And so it is the meeting them where they're at. If that's how they want to initiate services, meeting them there, engaging in that. And some people are okay to stay there. Some people, it is just they need some support with coping skills, or they need help navigating kind of some life stressors. Other times it's not appropriate, right? Like if we have safety concerns, or if the thing that is preventing me from seeking treatment is my anxiety of talking to someone, how much better is that going to get if I never practice talking to someone, right? And so sometimes it's the middle ground, though. We start with the texting and we start with those, and then we build to, okay, can we have a, you know, in-person kind of conversation? So it's really, I think for me, dependent on the need.
Mm-hmm. Talk about the struggles that I you know, of that, you know, that particular age group. I feel like there's a big difference between men and women in that age group as far as what they're struggling with. Would you agree with that, or not really?
I think it's actually all kind of the same.
Okay.
It's more still acceptable for women to talk about it than it is for men. I think that the young men that I see in that age group are still having the same questions of like, am I on the right track? Is what I'm doing with my life what I want to be doing? Is it meet my own needs?
But you've heard all the narratives about men checking out of society, and you know the influencers, and there's some really awful influencers in the male space, you know, boosting up, you know, this toxic masculinity and things. You're not seeing that so much in Erie or in your practices?
I don't actually have clients yet in Erie, but
Okay.
my Wyoming people, we don't have a lot of that.
Okay.
It is still pretty across the board. Like people just want to know how to take care of themselves and if they're on the right track.
So if they're already in therapy, if they're already getting help, they're that far ahead
Right.
of...
I think that's it.
Yeah.
So there is still something to be said for bad mojo out there that might be impacting our young adults.
Possibly.
Though I'll say because I was a professor, so I was in that realm of, I guess, age range. I saw a lot of what you were saying, where these guys women and men are both struggling with kind of the same things. It's just what group might be more vocal. And I think as the stigma reduces around it, I'm actually, and I mean, this was just a couple years ago that I was in the classroom, I'm seeing it. And these are athletes, these are master degree level people who are professionals in their career, and we were actually talked about it as a faculty, that we're seeing more and more conversations around it and needing to get them into services and knowing what the resources are. So I actually don't think that there's a difference between the two. I mean, and this is I guess a smaller population, but I'm seeing it across both.
Would you have recommendations, let's say, for the universities or for employers of large numbers of young people? Yeah, I'm thinking, Erie Insurance probably has a lot of 20-somethings in that big building, right? What would you suggest as professionals that they look out for, in addition to parents and grandparents and other support individuals?
I think starting with some of the typical stuff, if you start to see a drop off in someone's performance that's really drastic, if people are, not taking care of themselves and showing up unkempt, or, if it's
kind of that A student starts turning in D work.
Those kind of things are the things that start to become some red flags. I think I'd probably want to be starting there. What comes to mind for you, Carrie?
Yeah, I think about some of it is, I guess, supporting that age group is also understanding that, like, their values are different. Right.
Yeah,
and so the things that the older adults might have as like concerning behaviors, it's normal for them. Right. We're just different. And so being able to also empower them in some of that, like meeting them where they're at, of like, hey, they might need different forms of encouragement. They might need different ways to connect with each other and with their supervisors. And so building into some of that versus trying to just push the conformity of them modifying their behavior.
Okay. I've only got like 10, 12 minutes left, and I want to get to the young folks. And why don't we start with teenagers and maybe, post-elementary, your high school kids and so on. Are there different programs at the Achievement Center for like a high schooler versus elementary and even, preschool, right? You have little guys, right? That come?
Yeah. We serve kids and young adults birth to 21, depending on their need. And for the teenagers heading into like a transitional age, transitional adulthood, probably more of like our medication management services, where they'd be working with a psychiatric provider to determine if medication could help support them if they're depressed or maybe having a hard time focusing, those kind of things.
Are they able to get those diagnoses promptly? I mean, like, again, let's go back to primary care. They're supposed to be asking a mental health check-in, even if it's like, I guess, one question, right? And if they have to look up from the chart, right? Am I right?
Yeah. I think for kids in that space, teenagers in that space, I think having direct conversations about their feelings and not being afraid to talk about feelings with them, because it might be uncool or uncomfortable, like that's a myth. You can just directly talk to them about it. That's okay. And some people will be more engaged than others, but inviting the conversation, whether it's in a professional space with a provider that's trying to do a mental health check, or it's a parent trying to talk to their teenager at dinner, given the opportunity for that connection, we want to put it out there. I think it's just so standard that people think that teenagers are so standoffish and they don't want to talk about these things.
No, they'll talk about anything.
So don't feed into it. Like, let's actually approach them with these opportunities. And if we do it enough, even some of the more disengaged or quieter kids would come around.
Is there like a download or education or YouTube that you would point parents to? Hey, here, I think our, we used to do highs and lows of my kids. But they all graduated in the 2000s, right?
There's still versions of that happening. Peaks and pits.
Peaks and pits, yeah.
There's still some versions.
That was just our way of, seeing what's up and seeing who was mean and that kind of thing.
I think one of the things, as you're asking that, I'm part of Project Launch, and so I immediately think of, we're pushing this piece about parents checking in with their kids and making check-ins just as regular, right?
Yeah.
All the time. It doesn't have to be some big, huge thing. It doesn't have to be perfect. It's just showing up with them. And we talk about it in this context for, the littles, but I refer to them as like the bigs, but the bigger kids, right?
Right.
It's the same.
Yeah.
They just want that connection. And so I'm thinking of it, like our Project Launch stuff is really geared towards that birth to age 8, but a lot of those resources and a lot of those parenting pieces that we're going to be sharing out apply to the teenagers as well. Yes. Of they just want connection. They just want to be seen.
The studies I've seen still say that the number one influencer on a teen's life is their parents.
Absolutely. Those are the people that they're probably around all the time.
Yeah.
And kids don't grow up most often in isolation. They're growing up in a household with at least one other person there. So they're taking their cues, whether the parents or the caregivers are being real overt and direct about it or not, from that person, that adult that's in their presence all the time.
Let's talk about elementary. You mentioned Project Launch. What is that? And again, or is that going to be like a general public type of thing? Talk about that.
Yeah, so Project Launch, we are super excited about. So it's a 5-year initiative awarded to LECOM Health System, with Achievement Center being the primary. There's a technical name, right? Facilitator. But it comes through SAMHSA, which is the Substance Abuse Mental Health Service Administration. And so it's really about meeting the whole needs of the child. And so looking at the social, emotional, cognitive, physical, behavioral health, all of these pieces to assist kids from birth to age 8, because we know those early years are formative, and wanting to assist them in being well. And so how do we look at linking the things that are already happening? One of the things in the very short time I've been in Erie is there's a lot of people doing really good stuff. This project is not about like reinventing the wheel. It's about connecting the spokes of the wheel, right? There's all of these different systems and providers and agencies working with kids and families. How do we get parents aware that those things exist? How do we cross that gap of, hey, you have this need and this might be a thing too, and draw those people in? And so that collaborative effort to increase screening for kids and their parents. We know that when parents are well, kids are well. And so we're also looking at how do we support, parents who might be struggling with their own mental health or substance use and getting them linked up as well.
Yeah. Meghan, you're a communicator. Is this an issue that we're having still, that people just don't know what's available, you think?
For sure. And we're trying very hard to make sure that that's not the case. But
spend an hour on the radio kind of helps, right?
Yeah. Well, and I mean, I think one of the things, and we saw this even at the older adult side nationally, is that resources, Erie County is a very resource-rich community, but the organizations that hold the services oftentimes don't have exorbitant budgets that they can advertise.
Absolutely.
And so a lot of it's word of mouth. It's also a trust thing, right? So if you recommend it as my friend, I'm more likely to consume it. I could see 7 billboards out on I-90 and totally miss the message. But if you tell me about it, and that's why, I mean, there's a lot of grassroots pieces, but a lot of Project Launch is about taking what's already in existence and kind of raising it up and letting people know about it.
Neat.
Yeah, we want to amplify the really good work that's being done, and we're really proud about the collaborative way that this project is helping us to do it. One of the hallmarks of the initiative is a Young Child Wellness Council, and we have 27 other organizations and schools committed to this work with us, and we meet with them every other month, and that includes also families, parents, and caregivers who are supporting young children with behavioral or physical or developmental health needs, speaking into the work that we're doing, so we know that it's relevant and it's meaningful to what's happening in their worlds. So we're really excited about that. Lots of players, stakeholders, groups, businesses invested in this so that we could equip more families and professionals with the resources, the tools, the training they need to effectively support children. Talk
about how the new building enters into kind of the ecosystem now for behavioral health, because I think, and again, what's the title of the building?
The LECOM Medical Center and Behavioral Health Pavilion.
Yes,
Just
I knew
rolls
there
off
was
your
a
tongue.
pavilion in there somewhere.
The LMC-BHP, Joel. Come on.
Oh my! It'll always be MCC. No, MCH. No, but I mean, that really beefed up the opportunity for inpatient, for emergent behavioral health issues, right? I mean,
Oh, absolutely. And it is a beautiful, safe, state-of-the-art space. It was developed with the experience of the person who's coming in for help in mind. So the whole idea is that it would be inviting, it would feel safe, you could have your needs met, you wouldn't feel crammed, you would have access to spaces that just felt like they were therapeutic. And so it's going to help us, I think, reach a number more of people who would be willing to come in and give that new space a shot.
so if you're having a behavioral health emergency, if you're having a mental health emergency, and you go there, and the docs there say, we could help you. Will there usually be a bed for inpatient?
It looks different. It's depending on the age and the need, but more often than not, the team at LECOM Medical Center and Behavioral Health Pavilion goes out of their way to make it work.
Okay.
Sometimes that looks different. Sometimes that might be waiting in your room after you were assessed for a little bit longer until a bed's available.
Gotcha.
But they're with you to support you. They're not going to leave you hanging. If they think that you would benefit from being admitted and getting some extra help, they're going to help facilitate that. It just looks different. It depends on the time of day, the day,
I just feel, again, tell me if I'm wrong, but it feels like in this space that as soon as you build it, like the demand just expands to what the available space is.
Oh, absolutely. Yeah,
Like,
it's been busy. Yes.
Yeah, it just kind of fills up.
Yes.
In talking about all of that, and I think about the little guys, and I want to leave parents with some tools here. Again, especially when we're talking about the youngest ones, when do you get concerned about behavioral issues? I mean, but that 1-year-old that might use his hands too much, we can correct, right? I mean, we have tools to correct and procedures to correct that.
Yeah, I mean, we look at all behavior as some form of communication, so what is the child trying to communicate or do through those kind of behaviors, and is it functional or adaptive? Is it serving them? And if it's not, then we want to put a plan together to help them develop some more functional or adaptive ways of dealing with whatever that behavior was serving. But we know that it was serving some purpose, and we don't want to take it away without understanding what that purpose was and helping them to develop maybe a different, maybe more adaptive or functional behavior in its place. So that happens a lot in some of our behavior therapy programs.
And you do a lot of work with the families. And
Yes.
talk about that. You might have a child that's acting out, but the family gets included and maybe can get some tools
Oh, yeah.
for their communication and their
Yeah.
reacting to stimuli, if you will.
Yeah, and the programs that have the family style interventions embedded in them would be some of our outpatient services. So we could do family therapy where families come to our clinic for like an hour a week and they might get to do a family therapy session. We also do some more intensive family driven services where the team can go out to a child's home or a school or community center, and they can do family therapy in those locations too. And they would be on call and available all the time to support a family through a crisis. So I think we have the opportunity to intervene on a family level in a variety of different ways.
And if you're not sure whether you need these services, let's start with a conversation, right, with a professional.
Absolutely.
Yeah.
Yeah.
I mean, that's the first hurdle to just make the call.
Yeah. And
Hey,
it's,
this is what I'm dealing with, right? I mean,
and it's one of the cool parts about you. Yeah. One of the cool parts about Project Launch is launch control. I mean, this has this whole space theme, right?
nice. I like
And
it.
we're gonna just jet that space theme.
Yeah. So
Forever.
so launch control.
Put some rockets on it.
Yeah.
Yeah, and we love a good acronym in behavioral health. So control
yeah.
stands for centralized triage referral line.
Yes.
But basically, it's a hub. So we don't expect families or parents to be experts on our system. We know that's complicated. We just want to get folks equipped with our launch control number. Reach out to us. We're a hub. We're going to be able to help you. You don't have to have all of the answers. That's our job. Give us a call. We'll walk alongside you, help you figure that out. So we're in the midst of building that up. We're going to be launching in August. We have a team of 4 patient access coordinators and a director of our centralized access that's going to be working on being able to respond to phone calls, email inquiries, and a live chat, just to help parents and caregivers be able to wrap their mind around our system, because it's resource rich, but that also means it's probably a little complicated. There's a lot to deal with there.
So having almost like a one-stop shop.
Yeah, we're excited about it. And there's some awesome partners in Erie already in that space that we're going to be partnering with them as well. We don't want to reinvent the work that's happening, but we want to work with them. We want to amplify that. We want to get the word out. With the federal funding, we have a really good opportunity to do a lot of marketing and public awareness campaigns, so more people will see the message that there's hope, there's help. It's a phone call away, a chat away. We can get you some resources and get you set up.
Fantastic. I really believe that healthy families lead to a healthy community.
Absolutely.
And our region becomes healthier, doesn't it?
100%. Yes.
Cassie Dundon, Executive Director of Achievement Center, LECOM Health. Carrie Todd, Mental Health Systems Specialist at the Achievement Center. And Meghan Kinter, the Chief Strategic Growth Officer for LECOM Behavioral Health. Thank you, ladies, so much. Appreciate the time today.
Thank you.
It was a pleasure.
It is 4 minutes in front of 5 o'clock. It's Talk Erie and the Joel Natale Show, cruising along here on a Monday. Dean Pepicello joined.